Very large ameloblastoma. So this is extending from here till here, and that's causing this bony swelling as well.
Today we are going to remove that jaw tumor.
After we've done the reconstruction, so we've used iliac crest and we've got the mandible reconstructed.
There is a swelling since just 10 days it is, and she is recovering well.
For 3 times surgery, we cannot remove this ameloblastoma, and 4th time surgery was done by Sunil Richardsons hospital. After 10 days of surgeries, we are feeling very well and
So what you're seeing here is a very large ameloblastoma, and it's extending from the right side of the patient. You can see this is the first premolar and all the way up till the 3rd molar on the other side. The ramus is intact. She's had 3 earlier surgeries in the north of this country, and it's recurred 3 times. So she needs a segmental resection and reconstruction. So you can see on the face, it doesn't look as severe as you see on the scans, and that's because it's a recurrent unicystic ameloblastoma. I'm going to show you the extent of it now. So you can see this here. It's got small swelling. This is like a very fine swelling, and here also all the way up to this area you can see the swelling there, and inside all the way up to this tooth. So we're having a so this is extending from here till here, and that's causing this bony swelling as well. So we have to do a resection, segmental resection with reconstruction. And that's a scan of the patient. और यहाँ पे थोड़ा सा एक स्क्रैच आ सकता है इस साइड में, दिखेगा नहीं बिकॉज काफ़ी बड़ा है. ठीक है, थोड़ा दिन बस चलने के लिए पाँव दर्द होगा, थोड़ा दिन, उसके बाद
सब एक्सरसाइज
समझा नहीं.
अमाउंट
वो बाहर बोलेंगे आपको.
जितना मनी लगे कि 1 टाइम को देना पड़ेगा, थोड़ा 2 लाख के बाद 2 लाख की डिस्चार्ज करने के.
वो उनसे पूछो आप, तो बाहर बताएंगे आपको, मैक्सिमम जितना होगा वो बताएंगे. और ऑपरेशन के लिए 4 घंटा लगेगा, जल्दी नहीं ख़त्म होने वाला, 4 आवर्स लगेगा. आईसीयू में रहेंगे 1 दिन, लेकिन पूरा क्लियर हो जाएगा. ठीक है.
So today we have this patient who has complaint of swelling over her left side of the mandible. As you can see, she has a very huge swelling starting from the corner of the lip, extending towards the body of the mandible here. So the swelling is easily palpable, and also she had undergone some 3-4 surgeries before for this jaw tumor which she has, and still the swelling is persistent, and today we are going to remove that jaw tumor which has came out to be unicystic ameloblastoma as per the histopathological reports. So now we'll be completely removing the lesion, and we will be reconstructing by using the iliac crest bone graft that is the hip bone graft, and now we are shifting the patient to the OT theatre. So this is the intraoral, that is inside the mouth swelling, which you can see here, extending from here anteriorly going till the posterior region. It is very firm to hard in consistency, and we would be removing this entire jaw tumor and would be reconstructing the mandible.
So this is a patient, you can see has a very large ameloblastoma. Well, that's what the first report said. It also looks like a multiple OKCs. And she had 3 procedures before, and this is after we've done the reconstruction. So we've used iliac crest and we've got the mandible reconstructed. And this is the before and that's the after. Patient is totally fine. 10 days today, she's going to go home. She comes from the state of West Bengal. She's able to walk, she's able to move around, and we're going to show you how she's looking currently, even intraorally and extraorally. So even though the issue was a large major surgery, we've been able to reconstruct her lower jaw, and she could leave from here in 10 days time. She could come back after a few months, and if needed, even this place could be removed and we could put dental implants, and so that she could get normal teeth there as well. Thank you.
So this lady came to us with a complaint of swelling on her left side of lower jaw. This has been operated her 10 days back, and today she's getting discharged. So she already went 3 surgeries elsewhere. The reported as biopsy report came as an ameloblastoma. So she came to us with a recurrence. This is her pre-op pictures. If you look at closely, on the left side there was swelling. I'll show you in the warm side, it's much evident. Look at the lower border here, and in lateral profile it is visible. So what we have done for us, this enucleation, we have done a resection of the mandible extending from the angle region, crossing the midline till the opposite canine, and we reconstructed the defect with the iliac crest. We harvested the bone graft from the left iliac crest and reconstructed the jaw. Now there is a swelling since it's 10 days it is, and she is recovering well. She has a little bit numbness in the lower lip, and by and large the shape is good. After a month's time, once swelling subsided, she's going to look better, and the jaw is going to look very symmetric. Thank you.
She is my wife. We came from West Bengal, Jalpaiguri district. She is suffering from this disease few years, and we already done surgery this ameloblastoma 3 times, and this is his 4th times surgery. Before 3 times surgery, we cannot remove this ameloblastoma, and 4th time surgery was done by Sunil Richardsons hospital. After 10 days of surgeries, we are feeling very well, and she can walk and speak and eat soft eating. हार्ड आपका हड्डी निकल से तोड़ देगा, तो यह से हड्डी या कंस्ट्रक्शन हुआ. थोड़ा दर्द हुआ, अभी दर्द थोड़ा नहीं हुआ. She is now well, and all staffs and doctors of these hospitals are very good, and their behavior and culture, cleanliness of hospital are well now.